Tonight, we confront this painful but urgent truth for very many women in South Africa. Childbirth is not just vulnerable, it's violent. Obstetric violence, including verbal abuse, humiliation, forced procedures, and denial of dignity, is happening in public and in private healthcare facilities. And it's costing women their safety, their trust, and in some cases, their lives. Now, joining us this evening is Nonkululeko Mbuli, who is an Advocacy and Communications Strategist at Embrace Movement for Mothers. She is part of the Obstetric Justice Coalition, calling for urgent, time-bound action from Aaron Motsoaledi, who is the Minister of Health in South Africa, as well as the National Department of Health. Tonight, we unpack the memorandum demanding accountability, budget reform, legal recognition for obstetric violence, and dignity for every woman who enters the maternity ward. Nonkululeko, thank you so much for joining us. Welcome to African Diaries.
Thank you so much, and good evening to the listeners.
Let's just start off by giving context for listeners, for those who are listening, who haven't heard of what's currently going on. Perhaps let's start off by giving definition to obstetric justice, or rather violence. I think I'm going ahead of the conversation here. Obstetric violence and how this shows up.
I mean, we're eager to get to the justice part, but yeah, let's define the violence as well.
Let's define it, ma'am.
Okay, so obstetric violence is a very difficult to pronounce term that essentially refers to a range of human rights abuses that women and girls and birthing people encounter within the healthcare system. And this is particularly while accessing reproductive health care, and even more alarmingly, while accessing maternity care. And as you alluded to kind of in the beginning, is that it takes on a range of different forms. So it can be verbal, humiliating kind of comments made towards women that essentially strip them of their dignity. So verbal abuse, it can also be physical, as kind of unbelievable as it sounds. We know a lot of women are subjected to physical violence within healthcare systems. So it looks like, slapping, punching, beating, forcibly restraining women to beds, while they are giving birth or in labor. And then you also mentioned a very important one around non-consensual procedures. So we know that, for example, in South Africa, one of the issues that we've kind of grappled with, historically, and even in the new dispensation, has been around, forced and coerced sterilization. But there are also other forms of, and that's obviously the most egregious form of that, and has been recognized as a form of torture internationally. But it includes any kind of medical procedure that, has not, been accompanied by a woman's consent and informed consent. So thinking about, medically unnecessary C-sections, episiotomies, husband stitches, all of those kinds of procedures that would strip a woman of her bodily autonomy and her right to decide kind of what kind of birth she would like to have.
Nonkululeko, I got stuck at the physical violence. I thought it would be procedural, right? So perhaps the stitches were done rough for that kind of context. You're telling me that there's a physical implication involved that includes beating, that includes restraint in hospitals?
Yeah, it's such a huge indictment on our healthcare system that this kind of violence takes place. That's very overt. That's incredibly violent. I don't know if we can say violence is more violent, but yeah, things like beating. We've heard of some very horrendous stories, and I wish I could say that these are just isolated incidents, or it's just a few bad apples here and there. But what our research shows, and what we also know from kind of anecdotes that we've encountered as we've been doing this work, is that obstetric violence in all its forms is prevalent within South Africa and also across the continent.
Nonkululeko, let's give context. How rife, how widespread is this issue?
That is a very interesting question. So, because obstetric violence is so incredibly normalized and has been for the longest time, to the point where women are kind of warned, particularly if it's your first child, you're warned by women around you about, this is what's going to happen to you at the hospital. Just, try and keep quiet, and you'll kind of make it out alive. And I mention the normalization of it because that is the reason why it hasn't really been a kind of, site of study or inquiry outside of, for example, some qualitative studies that have been done. So we commissioned a quantitative study at towards the end of last year to try and understand just how prevalent it is in our healthcare system, and we focused on two key provinces in South Africa, so Gauteng and KwaZulu-Natal, and we found that 6 out of 10 women in these provinces had experienced some form of obstetric violence, which is really, really high. That's more than half of women who go into the healthcare system seeking care and, seeking a safe delivery and birth, leave traumatized by these kinds of acts of violence.
The voice there of Advocacy and Communications Strategist at Embrace Movement for Mothers. She's part of the Obstetric Justice Coalition, calling for urgent time-bound action from the Minister of Health in South Africa, Aaron Motsoaledi, as well as the National Department of Health. And that is the conversation this evening. Send through your questions if you have any. Find us on WhatsApp +27 83 288 6684. Nonkululeko, as you speak, every single time you give a response, I am left breathless. Because you can imagine that this has been so ingrained into culture that dealing with the problem is not going to be from a governmental stance alone. It has to do with changing and shifting the culture, the headspace. Because if we're talking about healthcare, this boils down to individuals. And if individuals are so comfortable doing these things, and we're talking about some level of normacy around the act, that means there is a whole school of thought that approves of this. How do you reckon we change that?
Yeah, all of it that you've just said. I'm kind of mulling over it and how you've been able to very kind of accurately pinpoint the issue. So I think it's very tempting to kind of, want to go big and look at the systems kind of issues first. But at its core is a belief system that says, that women's bodies are not important, that women's autonomy is not important, that women's rights to safety and to dignity and to equality are things that aren't important, and that obviously creates a particular kind of institutional culture. And then when coupled with, the kind of lack of accountability that we see within, the healthcare system, it's really just the perfect storm. So I remember, I think it was like 2 weeks ago, where the Gauteng MEC, in response to, being kind of quizzed about, the shortage of hospital beds in Gauteng, responded and said, "Oh no, some women really prefer to give birth on the floor," and that is
Mm,
absolutely mind blowing to the
mm,
ordinary person. But if you think about the fact that this is someone who is in a position of power within the healthcare system, and is the very head within the province of Gauteng, one of the provinces that we conducted the study in, it kind of makes sense why this kind of institutional culture continues to continue um, unchallenged. So there are a number of things that we have identified as key levers to changing the status quo and to, embedding the principle of respect for maternity care, which is really a World Health Organization term. And respectful maternity care essentially speaks about a rights-based maternal healthcare system where it's not just looking at, maternal mortality and, did you die, which is very often, one of the kind of things that we often hear is, okay, but at least you made it out alive, at least you made it out with your baby. So looking at the experience that women have, within the healthcare system, and that's really what we are trying to embed here in South Africa's healthcare system. And a good place to start would be firstly with the recognition of obstetric violence as a particular form of gender-based violence. Um, so that is really the starting point. If we cannot acknowledge that this is something that exists, that this is something that is pervasive and prevalent, then we have no place to begin legislating from. We have no place to begin kind of systems change work on. So accountability is really the most important one. Government coming to the party and acknowledging that there is a problem, and that they have a constitutional obligation to addressing that problem and preventing the continuation of that issue. The memorandum that we delivered to the National Department of Health also speaks to resourcing, maternal health care. South Africa, we are amazing at writing policy documents and lots of paper, but not so great when it comes to implementation. In 2024, new guidelines were introduced, clinical guidelines for maternity kind of care. And for the first time, it included a chapter on respectful maternity care. But what we are finding is that if respectful maternity care has not been specifically budgeted for, then it can't be implemented. So that's the second thing we're calling for, is really a gender responsive kind of lens when we look at the healthcare budget. And then the third thing we are calling for is raising awareness about obstetric violence, and about patient rights and about the right to recourse and what that recourse would look like for women who experience this.
Nonkululeko, I found that in many cases that having people being held accountable to an
Mm.
extent for fault has them fleeing the other direction, right? Because I understand that you're calling for some kind of reform by August 2026. However, the implication of the matter at hand means that every single nurse that was ill-treating a patient is going to be investigated, because I do understand that you are also looking for independent investigations. And so
Mm.
how are you going to, what's the plan around mitigating people's sentiment? And I know it shouldn't be a priority, but the reality is that because this has become such a rife and problematic cultural practice, that you have more people who are offenders and a very small minority who may not be. And so how do we plan to mitigate that so that even those who are accountable understand that we need to change the way we do things and not necessarily you are at fault?
That is, yeah, that's very true. So it's very interesting that you mentioned that, because what we also picked up on, in terms of what are some of the things that drive the prevalence of obstetric violence, is a very punitive kind of culture within the healthcare system, a very hierarchical and very punitive culture. So, for instance, we've had women who have told us, the nurse kept, slapping me, and telling me to open my legs, yelling at me. And she kept saying, you're going to make me lose my job. You're going to make me lose my job. So I think, we come into this with an awareness that in a broken system, there are no winners. So yes, we are calling for accountability, but what we are calling for is a systems level accountability where the health system itself is held accountable. And what we are also calling for in the memorandum is continuous training on respectful maternity care, but also adequate support, and a healthy, safer environment for healthcare workers to be operating in, because it is unconscionable that we would expect, overburdened, exhausted, healthcare workers who themselves are not cared for within the system to provide adequate and compassionate care. So looking at this through the lens of kind of restorative justice, and that's why even in these engagements that we are continuing to have, going into the launch of our report next week, we have invited health workers and associations and organizations to the table for a very honest conversation about what a coordinated and collaborative approach to addressing obstetric violence would look like.
The voice there of Nonkululeko Mbuli, who is an advocacy and communications strategist at Embrace Movement for Mothers. And we're looking at the memorandum that was submitted to the Minister of Health here in South Africa, and of course, the National Department of Health, really demanding accountability, budget reform, legal recognition of obstetric violence, and dignity for every woman who enters a ward. We're going to take a quick breather. Send through your questions. I'd love to hear from you this evening. Find us on WhatsApp +27 83288 6684. It is 19 minutes before the show comes to an end. We are wrapping up conversations with Advocacy and Communications Strategist at Embrace Movement for Mothers, that is Nonkululeko Mbuli. And we're addressing the memorandum demanding accountability of all kinds, to be honest, when it comes to the realities of obstetric violence in South Africa. And the idea truly is that it would permeate throughout the continent, this sorting after for justice, and essentially just a safe space for women to give birth. Nonkululeko, in the interim, as we wait for responses from government, are there ways that we can deal with the hospital on the account of just the hospital itself, on that basis? Is there a way we can go about doing that?
Yeah, there are, and this is where I suppose it gets tricky, right? They are and they aren't, because what we are finding is that the reporting processes aren't necessarily victim or rather survivor friendly. So we have complaint boxes, we have internal processes where women can take these issues up with hospital management. We also have, a hotline for the health ombudsman where you can lay a complaint and have your complaint, investigated and recognized, and where you technically have the right to a response. There's the public protector, there are the various associate professional bodies and associations that you can report individual perpetrators to. But what we know is that these pathways have not really been effective in terms of ensuring redress to women who have experienced this. So part of the study also looks at the reasons why women have felt that they could not report this. So if you think of kind of how the South African healthcare system is structured, and the points of entry into the healthcare system, it's your local clinic, it's your local hospital, and women have said, even if I wanted to report, the issue would be that I would still have to attend, the same facility where I was violated, and that alone makes me afraid of retribution, for example. So a lot of these complaints processes aren't necessarily protective of the person reporting, but also you're not guaranteed, the kind of response that feels like justice. We've heard of instances where women have, been offered a basket, after being forcibly sterilized, and taking it up with hospital management, like a gift basket. You have just taken an organ and indelibly, impacted my life. And that's another thing that we're calling for is a functional complaint system, that is responsive to the kinds of realities and needs of survivors, and that ensures proper redress for people who experience obstetric violence.
I think, Nonkululeko, ours is to follow up with you moving forward to see what the progress is. Firstly, thank you so much for taking the time to partner with all the individuals behind the memorandum, but also all the individuals on the ground who are willing to do the hard work to see this change from obstetric violence to obstetric justice for all. Thank you so much for joining us.
Thank you so much, Shayla.
The voice there of Advocacy and Communications Strategist at Embrace Movement for Mothers. She's part of the Obstetric Justice Coalition calling for urgent time-bound action. And this from the Minister of Health as well as the National Department of Health here in South Africa. The voice there of Nonkululeko Mbuli.